Hello, and welcome back to the Hit Like a Girl podcast. I'm your host, Joy Rios, and today we continue our deep dive into Techquity, our 5-part series focused on digital health equity. Each episode will explore different facets of how technology can bridge gaps in healthcare to ensure equitable outcomes for all. Joining us again to kick off this interview is Jana Guinan from the Health Foundation. Today, Jana will discuss the Coalition's current endeavors, including drafting vital recommendations and those best practices that can be used in the healthcare industry. Welcome back, Jana. It's wonderful to have you share these initiatives with us. I'm so grateful for you.
Hi, Joy. Thanks for having me back. For anyone who is just joining us for the first time today, Health Foundation is a nonprofit organization that has an initiative called the Techquity for Health Coalition. And as Joy mentioned, we're working on developing best practices, recommendations, and also metrics for digital health equity, or Techquity. We just finished our first Techquity for Health case study competition in February. So in this series, you will hear from 5 different winners in an interview. And here we are, Joy and I are just kind of giving you some context here about the coalition and about Techquity to set up these interviews. So you'll have a little more context for the conversation. So now that we've concluded the competition, the coalition has a really fantastic, rich database of information from our close to 200 submissions that we got through this competition. And this is what we're going to use to kind of learn and to check our understanding of perceptions of Techquity, practice of Techquity today, and where we think it should be. So we want to provide evidence-based information on how to use digital health and data to reduce health disparities, and also to avoid or eliminate inequities in healthcare. And there have been many famous examples of how Techquity could really get in the way of that, but also just as many, I think, of how technology can be extremely helpful in decreasing barriers in many ways and making healthcare more accessible, potentially more affordable and effective. So that's what we're working on. And we are only focused on underserved populations. So the people most in need in our country. We just want to influence how every single stakeholder in healthcare technology, I shouldn't use the word just because this is such a bold thing to say, but we hope that this happens. The dream is to influence the way stakeholders in health technology consider health equity from the outset of any project. So whether it's an app or telehealth program or any other tech-enabled intervention or use of data or algorithmic analytics, all of it, we need to have that consideration. So using these insights right now, we are preparing a white paper that highlights what we identified as best practices through this case study and our prior work. And we're also planning to publish the individual winning projects, and we want people to see in detail these case studies and to make them visible to a wider audience. And then the next kind of thing that we're planning, we're launching a Techquity Learning Collaborative, and this will be a chance for our winners, case study winners, and our advisors at first. We're kind of treating it like a beta. And the goal is to foster this community of mutual support and knowledge exchange in Techquity. So again, it's sort of going to be beta at the beginning, but our winners expressed a strong desire to get to know one another, to learn from one another, and our advisors are also equally invested. So we're going to start with them. And we'll see how it goes, right? After that, if everything goes well and we think that we have some real value to offer everyone else, then we'll consider opening it up to make a larger, industry-wide Techquity Learning Collaborative. We'll just see. And then generally, I will say that this is going to be a huge year of outreach for the Techquity Coalition. A few of the things we have coming up are a roundtable, which will host Health Europe. And the purpose of that is really to just begin to get feedback on our best practices and recommendations that we're putting out shortly, and gather information from people in other nations about the conversation, the culture of health equity, of digital health equity. Who are the leaders? What are the projects? To just start to understand so that eventually we can build that bridge and adapt our recommendations for other places. And then, I'm working on, I won't go into it all, but I'll just say I'm working on bridging to other organizations, developing partnerships. One important one for me this year is sitting on the Digital Health Collaborative that Peterson Health Technology Institute has rolled out. I'm very thrilled that they are considering Techquity as a really important aspect of the work that they are doing. And we'll be, conducting workshops and out there speaking about Techquity this year. Again, just a big year of outreach for us.
You guys have so much going on. You've come so far and you have so far to go, but it's just really, really, really exciting to see how far you have come and the progress that has already been made. And it's remarkable how many insights you've been able to collect in just this short amount of time. And so I am so excited to see the progress and how you guys are taking this conversation globally, and the expanse and impact of your work is really, really impressive. So thank you so much for what you're doing. Now let's turn to the exciting part. Who is joining us today, Jana? Can you tell us a bit about our interviewer and the incredible awardee we'll be hearing from?
This is going to be a great conversation. Today's guest is Chrissy Kuahine, who is Director of Clinical and Patient Informatics at the Waianae Coast Comprehensive Health Center on Oahu in Hawaii. She is being interviewed by Dr. Michael Penn, who is a physician advisor for health equity and innovation at the American Medical Association. And I will say this is a giant of a conversation. I know you were there for it. It was really interesting, and they just brought so much to the table in this conversation. So Chrissy's project addresses digital literacy and connectivity among elderly Native Hawaiians. And I'll just point out a couple of things. One really interesting aspect she mentions is the use of digital navigators. And they're people who helped the program participants feel comfortable engaging with technology. This is just, she did a lot of work to understand what it would take to get people to really engage. She also weaves in a few Native Hawaiian words, which I just loved hearing, so that's a fun bit. She's a really good cultural ambassador, and it's something that when you meet her, you'll just hear it's just a part of how she lives every day, like knitting together Native Hawaiian culture together for the rest of us who may not really understand the values, the words, etc. So that was fun. Chrissy's an informatics leader, and she has a really deep data set, like an enviable data set at her fingertips, decades of patient data. And because she serves a large Indigenous population, her project was set up to combine a really tight, evidence mindset, very experienced group there, the soft skills of valuing community, respecting culture. And there's also a big piece of this at the beginning that talks about historical context and the meaning of historical context and why it's important in delivering programs around Techquity. So I'm going to say to anyone who is listening who's a skeptic about the importance of soft skills and how those can lead to results, please listen until the end, because another really exciting part of the conversation does come at the end. Waianae Coast has developed what they call an impactability score. This is something that they made up. This shows, just because of the data they have, let me just add, it's just because of the depth and the breadth of data, they're able to show what kind of influence they can have on individual patients and their behaviors. And they can pinpoint the approaches that will influence that patient's behavior and cost. So overall, my takeaways from this conversation are that when you develop programs with collaboration and respect for culture, and then you have appropriate data capture, eventually, and this is what Chrissy leaves us with, eventually you will be in a place where you can negotiate your own models with payers. So this is a really good one. Let's turn it over to Michael and Chrissy.
Hello, I am Michael Penn, Physician Advisor for Health Equity and Innovation at the American Medical Association, and also advisor to Health Foundation's Techquity for Health Coalition. And today I'm here with Chrissy Kuahine, Director of Clinical and Patient Informatics at the Waianae Coast Comprehensive Health Center. Welcome, Chrissy.
Aloha, kakia, Michael.
Aloha. Kakia means morning, right?
Good morning, yes.
Yay.
Yep. Yay.
Tell us about who you are, what you do, and how that helps the health center that you work at.
Sure. Well, mahalo, first of all, for having me here. Nice seeing you again, by the way, Michael. We were both at ATA.
Yeah.
I work at the Waianae Coast Comprehensive Health Center. We're a federally qualified community health center in Hawaii on the island of Oahu, on the west side of Oahu. And I always say the west side is the best. It's interesting. West side is best side. For community health centers, it's interesting. Folks always ask, what do we do? And quite honestly, we do everything. I think the last statistics that I've heard from NAC, National Association of Community Health Centers, 1 in 4 folks in the United States have received or are receiving services from a community health center, sometimes whether they know it or not. And so really, for our health center, I think we're unique in the fact that we Our patient population is predominantly Native Hawaiian, of Native Hawaiian descent. And so with that, we have to address some unique cultural aspects as well as historical. And so I've been here now for 34 years. When people ask what I do, I've worn many hats over that time. So I have some good clinical insight. I was a medical assistant for many years, and then move over to the technology side when we switched from our paper to an electronic medical record, which is now, 24 years. So I will have to say our health center is really, I think, a testament to community-driven healthcare. I think we've done a really good job of blending tradition and innovation. Western medicine and Native Hawaiian medicine, we have a Native Hawaiian Healing Center. And so we know the importance of reconnecting or keeping the connection of healthcare when it comes to there's a place for Western medicine, but also traditional practices.
So I want to unpack the cultural aspect a bit, because I think one of the greatest opportunities, I think, in healthcare is to actually tailor and target the delivery of care through the lens of a patient's cultural lived experience. And so, one, can you give us insight into how that impacts care, right? So how do you make decisions based on insights that you have from a cultural perspective? And then I want to ask a broader question.
Sure, absolutely. I think what it comes down to really from a community perspective. So whoever you serve, whatever their cultural background is, again, we're predominantly Native Hawaiian, but we also have other cultures. We have our Pacific Islanders in our Asian community. And so really it's the connection with community. And I was just talking to some folks who came out here to introduce a particular new technology. And they asked the same question. It said, really, it is about going out into the community. So it helps. I'm born and raised here. I live in my community, work in my community, but going out to our different community summits, to our grassroots, different organizations, and really hearing what our community's priorities are and what their needs are. And in terms of healthcare, I mean, there's lots of health inequity. There are a lot of, in terms of digital, there are a lot of digital inequities that we know exist. And so really what I feel like my job and the value I bring to my organization, my community, is listening to really what folks' needs are. I might think that they need something. My executive team might think, that the community needs something, but really it's about making sure you listen, you communicate, being open to what people's lived experiences are, because really that's going to shape what we can do best for our community.
Thank you for that. So you recently won the Techquity in Action Award for a specific project that addressed some of these barriers that you just alluded to for the indigenous elderly population. And this was a special award sponsored by the American Medical Association in conjunction with the Health Foundation's Techquity for Health Coalition. So tell us at a high level about this project, right? What problems were you trying to solve and what did you actually accomplish?
Sure thing. Well, first and foremost, it really was kind of a surprise. I mean, I submitted the case study just in hopes of having 10 minutes to share what we experienced and what I really feel like is something that's replicable in other communities. Not so really, honestly, as I go through it, you'll kind of break down and go, wait, there's not really anything special or hard about it. It's just a matter of understanding the greatest need. And then having, in our case, we targeted and focused on a particular population. And so from 2020, we were able to very quickly, in our EHR system, create a way that we could collect data. And I think I alluded to that as to why our folks were connecting via telephone versus televideo. And so what we quickly learned is we have two things. We have access issues, right? So whether or not, again, unstable or just no internet access at all. But we also saw that there were some low digital literacy issues, and especially in our patient surveys that we take included in 2020, we started to include telehealth as an experience, overall satisfaction, how hard is it to connect, and we then break it down into age. So maybe not surprisingly, but surprisingly to me, as they got older, the ability to connect without having any problems was much higher for our 60 plus. But the other thing is too, here we all live multi-generational. I mean, a lot of it is cultural, but then some is economics. It's high cost of living here. So I think we saw with our own families, our kapuna were afraid of going out because they were getting sick. And at the same time, when it comes to the digital literacy part, they may be connected. But I don't know about other places in the US, but our folks, because of cybersecurity and people, our elders, kapuna, our elders getting scammed, it was always, don't click the link, don't click the link. But then I remind folks to connect with your provider. You get a text or an email, and how do you connect? You have to connect the link. Click the link, right? And so it's a matter of educating our kapuna in this case, and we really targeted them because we also have a kapuna council, so an elders council that runs our traditional healing side of our services. And they were giving feedback about, hey, my peers, my kapuna friends, they're afraid. And so what was happening is they just weren't seeing their doctor. They weren't following up. And so I talked to my kapuna, my Auntie Nalani, and we together said, hey, let's put something together, make sure that we address everything that we need to in terms of creating a tailored computer basics, like basics, not 101, 001, and get the right trainer and the right folks involved. And so we did that. And then I needed access. So I made friends with the for-profit. I know we're going to talk about that in a little bit. But we set up a community Wi-Fi, which was eventually for that program, but now has blossomed into a community Wi-Fi initiative. So the access part of it, addressing that.
I guess I want to challenge you a little bit around this is easy, because I've learned a lot more detail from you since providing the award. You're a pretty unique individual, and the things you take for granted in terms of being a connector, being really taking the initiative, being a native Hawaiian, right? Like all of those things, it seems to me, are really critical. So what is translatable, right? So if you can distill down, because not every place has a Chrissy. They may have approximations, but yeah, talk to me about the generalizability.
Sure. So number one, can't do it by yourself. It's not only me. I will say probably one of my strengths is I like to make friends. And I'm always open to what others may not think is opportunity. And it's not to say that I make friends and somehow we end up with a project, but you don't know unless you are open to the idea. And then really what we call in Hawaii, talk story, right? And I don't know if it's maybe folks don't have time or think that it's maybe not worth the time to talk story, but it's pretty cool how far you can go with just letting folks know what your initiative is, whether it's for you, your community, your organization. And then all of a sudden you find like there's some common goal. And so that's really, I think, putting the strategic partnership part together.
Yes.
In terms of what's relatable in each community, we all have a target population, whether that's going to be a kapuna, your elder, whether that's going to be, if you're looking at the younger generation in Hawaii, we call that our OPO, right? Our young ones that are coming up. And if anybody that we want to make sure we instill whatever initiative it is, right? Whether it's improving health literacy, whether it's letting them know that they all know technology is here, but how can we use it, whether to shape a career path, or in our case, quite honestly, when we set up the kapuna program, we knew that they weren't going to come by themselves, right? So we said, make sure, bring your caregiver, bring your mo'opuna, right? Your grandchild. And sure enough, there are quite a few kapuna who brought their in sixth grade mo'opuna, right? Their grandchild, because if anybody knows technology, it's going to be them. And how wonderful that is, right? To build that relationship between your kapuna and your mo'opuna. But then also too, they have a common bond. And really now your kapuna is learning and not just, no, grandma, I'll do it for you kind of thing. And so I think that's relatable. right? There's relationships and family. And then at the same time, understanding, I think going back to what your community culture is. So we understood kapuna not going to come by themselves. We made sure we had digital navigators because kapuna more likely, or they're not going to be willing to raise their hand if they're lost or left behind in that part of the training. So I think just making sure, again, and I didn't do it again myself. Auntie Nalani, what do we do? How do we? She was my connector. Because she had kapuna who, right up until the day before the class, called her and said, I don't know, do you think I can? Do you think I have? I feel nervous. I've never turned on a laptop. And so having those folks that can also make the connection. Because I'm not kapuna yet. I might be pretty close, but I'm not yet. So having the kapuna peer so that they can motivate and bring confidence to each other.
So the other thing I heard is somebody in the organization needs to have an external lens, strategic partnerships lens. And the personality that would support that and the skills and the gifts that would support that. I also heard your Kapuna Council, your healing council. I forget exactly so that's beautiful, right? Like recognizing that there's healing beyond Western traditions and so talk to us about that marriage, that blending, because it seems to me that I know that FQHCs tend to have people from the community on their governing boards, but it sounds like what you've put together is even beyond that. And so, talk to us about marriage of the cultural.
You're right. So the real beauty of community health centers is you have a board over 50% of your board have to be patients from your community. So really community health centers are driven by their community board. On top of that, for us, our Native Hawaiian Healing Center, which we do have a physical Native Hawaiian Healing Center that was built here on campus. And in the Kapuna Council, each of them are practitioners. So one may specialize in la'au lapa'au, which is use of herbs and medicines, herbs for medicine, lomi, and if I say lomi, massage. So there's a practitioner for that. So each of those folks have been blessed with that gift, that healing gift. And so they bring that to our community. And how that's weaved into Western medicine, the way that it works is our Western practitioners don't refer like you would in a normal referral, but our community knows that it's available because that's really part of everyone growing up. And so they know that they can go there at any time. And that's for employees as well, and use any of those services, including Ho'oponopono. That's one of a big one. I always like to highlight this one. Ho'oponopono is a way for conflict resolution. So it's a non-traditional way of conflict resolution, very important in Native Hawaiian tradition and households. So if you can imagine this, if a family is having conflict, whether it's some pilikia, some conflict that's happening, a lot of times that can manifest with, you go into your doctor and my stomach hurts all the time, or I have a headache all the time, or I just don't feel well. A lot of times Western medicine said, well, here, let's take an antacid or some kind of pill. When in reality, if you really break it down, maybe there's some family strife that's happening. So Ho'oponopono is a way of bringing everyone together, addressing really the root of the issue, which may not be physical, but it's emotional that's now manifesting itself as physical. So I think that's really the beauty of just bringing those things together, because then you're really truly from a traditional Native Hawaiian aspect, you are healing the person. I mean, that's the whole holistic approach. And so I feel so grateful and fortunate we're able to provide that to a community who really just historically that had been lost because of European occupation and things that happened in the past, but that now have brought us to where we're at. So there's definitely a healing aspect that I think is so important for our community.
At the risk of opening a can of worms, you mentioned essentially colonialism, right? European occupation. And I had an opportunity recently to travel to Montgomery, Alabama, and there's a series of museums, monuments, and memorials that really unpack the experience of slavery and Jim Crow and Reconstruction and racism and mass incarceration. And I don't think until going through those sites, I appreciated the profound impacts of sort of colonialism and sort of that mindset of domination, essentially, right? And acquisition. And I think the healthcare community often looks at disparities almost through the lens of, well, why are these people doing this to them, right? Like, why can't they make better choices? And if you actually look at the history, right, like colonialism, racism established many of these patterns long before people. And so talk to me about what you see in your community, because I think this is something that people in the healthcare community don't understand enough of. And I think if more people did, it could really shift how they approach care delivery.
Oh, absolutely. I'm so glad that you brought that up, because you're right. I think if you don't know the history of a particular, in our case, Native Hawaiian experience, you might think that they're illiterate in terms of their own healthcare or their mindset. It's about this particular point in time. But really it isn't. If you go back to Native Hawaiians, they were the healthiest. And if you look back at at old photos. Duke Kahanamoku is a great one. He was a Hawaiian Olympic swimmer. And if you look at his physique and his health, I mean, that really was representative of Native Hawaiians. They lived off the land. Everything that they had, their aina, their land, their vai, their water, they had everything they needed. And then Captain Cook discovering the islands, I mean, that really started off the whole disease, right? In terms of introducing disease that Native Hawaiians did not have the immunity for. So then you talk about now a decimation of a population from anywhere from, there's really hardly not true numbers, but some say as much as almost 1 million Native Hawaiians. Once Captain Cook left and other European folks introduced other diseases like measles, half the population was. And then you have the U.S. unlawful occupation and overthrow of the monarchy. And literally, I mean, this is not even exaggeration, the whole identity of a Native Hawaiian was stripped. And so I'll give you an example. If you're getting ready to go to high school, and if you're not speaking only English, you weren't allowed to go to high school. So now what does that do for in terms of education and where you are in terms of level and your knowledge? So you didn't have that. And then losing your language and how you can care for yourself in a way. And then that was all lost. So now we have where we are with health disparities. Our own community, if we look at diabetes prevalence, we're double diabetes just in my community compared to the state. So that's telling, right? And so these are things that we have to keep in mind because it seems like a long time ago, but not really for Native Hawaiians. It hasn't been that long and it's just through generation and generation. So trying to be, I think, first of all, understanding it, and then you can approach it in a way that diabetes was not part of your family. This is not something that, well, my grandpa has it, my mom and dad, thus I will have it. No, doesn't have to be the case. And so, yeah, thanks for asking that. I appreciate it because I don't think most folks know.
You're welcome. You had this ambitious goal of empowering your elder community with tech literacy, with Wi-Fi, being able to access healthcare providers in a variety of different modalities. How would you describe sort of the outcomes of this work?
It was actually pretty remarkable. So we started off with some of the partners that we worked with, especially our trainer, and that was really I wanted to make sure that we had someone that was patient, number one, right? And who really understood where our kupuna was coming from in terms of being nervous, not being confident. A lot of them had cell phones, but really either their mopuna or their adult child set up everything for them. They may have had an email, they don't know how to access it, or they don't know how their password. So I had a really great trainer, Native Hawaiian, who had been around our state and specifically training kupuna, so it's very patient. The other thing that we made sure to do was we wanted to not only train our kupuna, we wanted them to leave with a device. So we partnered with actually 3. One of them was our state library system to have our kupuna walk away with a refurbished laptop. Once they were done with the training. Yeah, so after their first 3-hour training, they walked away with a free laptop. And then one of the things I did want to make sure, I mean, this is something too that can be incorporated for others. And I'm looking at my list of things that was really important. And maybe for some they make really, but if you think from a cultural perspective, we started off every single training session. So it did blossom from 1 to 3 based on kupuna request, right? We always started off with either a pule, prayer, or an oli, which is the mele, or both. And really that was from a traditional standpoint, it really is for gratitude for our generations that have come before us. And then also to just asking that we all of us involved in this process, that we all have strong minds, open hearts to learning new things. And so we always started off that as a reminder. And I think that honesty can resonate. And however that is, even if you're just saying it, let's go in with an open mind. And then technology doesn't seem so scary then, right? So some of the outcomes, we started off with a survey. So a baseline, how comfortable are you with technology? Are you visiting, or have you thought about using telehealth to visit with your provider? So at the end of our 3-hour sessions, we did a survey on all those things. And so 70%, 76% of our kupuna felt more comfortable with using this case, a laptop. Some of them had never turned on a laptop ever. So just turning it on was like everyone was cheering, yay, we got on. 83% said that they felt more comfortable with their computer skills. And then this is what I really love, 72%. So most everyone reported that they would be interested and or were ready to connect with their provider via televideo. And that's really what it's about when it comes to Kapuna and having the knowledge and then now the confidence to do it. Because what really saddened me was that they just accepted that they wouldn't see their provider until it was over. And look, it was almost 4 years, right? 3.5 years.
Yeah.
Yeah, it was definitely something that, and then we have our Wi-Fi. So I told him, hey, come to our cafe. We have a cafe on campus. I forgot to mention, we have lots of things here, but come back to our cafe where you learned how to get connected. Mm-hmm. And then you bring your laptop and you can meet up with your friends. One of the things too that I don't think folks realize, we think kapuna, they're retired, they're not busy. But I tell you, our kapuna, they're very much into civic engagement. And so one of the things that I like it brings me so much joy that happened at the end of our third class where we all had done Zoom and folks are ready to go into their digital world, right? They crossed the bridge over. One kapuna said, thank you so much, Chrissy, because all this time I had been in person to our neighborhood board meetings. I had been volunteering for all these grassroots activities, but it was all in person. Once everything got shut down, he wasn't able to connect, and his friends were calling him saying, hey, come on, you got to get on Zoom. And he was like, I don't even know how. So he said, once we got on Zoom, he said, now I can get back to my neighborhood board meetings. I can sign up for the positions that we want me to take. So think about it now. People go, oh, great for him. I said, no, but think even bigger, right? He's now being able to get back and being active and doing things for our community. So that's one person, but how many people in the community now are going to benefit and are touched by this one class, right? That's big.
I think we often overlook the ripples that one intervention can radiate out to the community. So the other thing that I just thought was amazing when I read your case study is how intentional you were to leverage bleeding edge technology, right? So AI, measuring sort of the cost savings, the outcomes. So give us a high level view of that, those dimensions.
For a CHC, I like to say in the middle of the ocean, literally. We're really a diamond that folks are pretty surprised at how advanced in terms of innovation. But, part of our mission statement, believe it or not, is that in order for us to make sure that we provide the best quality of care to our patients is that we will use innovation and emerging technology. So I think that's pretty telling, right? We'll be 52 years this year. So when you think about our founders and what they were thinking so far ahead, then our CEO who really knew that data was going to be important, and that we're talking 30 years ago.
We need to pause on that because we're talking decades worth of data. Mm-hmm. So when you say AI, you're talking about decades worth of patient information. Very few centers, even health systems, right? Large health systems have that breadth and depth of richness of data. Mm-hmm. Kudos to your CEO. What's his name?
His name is Rich Bettini. And I tell you, I used to say, hey, Rich, where's your crystal ball? Because for someone really, and we're talking about care enabling social services, the kinds of services that we know contribute to healthcare outcomes from a holistic approach, right? So we're not just talking CPT diagnostic codes. We're talking about, if anyone in the healthcare industry knows, it's not just about meeting your provider and you leave the office. If there's a referral to a specialist, or if there's a new medication added to your, list of medications, or some new health diagnosis, if there's time that someone, either you, the provider, your clinical team, a case manager, sits and explains what's happening with your care, or what is the next step, or with your family. Now, if you don't code that, the peers don't know. They don't see that complexity, especially in a community that we serve. We're underserved, marginalized community. So there's so many other things that contribute to a person's well-being. And we all know that as social determinants of health. We've been collecting all of that data for 30 years. No, we didn't use it. We knew we would use it at some point, right? And then if another kind of just giving an idea of how, I'm going to say, technologically advanced for a community health center, we've had our electronic health record for 20 years. We purchased our electronic health record with our own money, not with a grant. So I think that I like to say that because that's even telling about how we knew Our data would help to prove our value. That's one thing I think that all community health centers and even other organizations, to the folks that are making the rules in terms of reimbursement, in terms of whether or not, in this case, telehealth, really, is it going to help with healthcare outcomes? Is it going to cost more money? Is it going to be a cost savings? We have to prove it. That's on us, right? Because we know what we do is important. Our patients are. So in order to do that, you have to have the data for sure.
Congratulations, because that is a huge accomplishment, but more importantly, it just positions you to really serve your community and provide the best care possible. My view is that, when you look at kind of the annual sort of cost to our country of health disparities based on race and ethnicity, it's nearly $500 billion, $500 billion each year. And it's only going up. That if we don't leverage the best of what innovation and technology and data has to offer, I just don't think we have a real shot. So this is part of why I joined the AMA to look at this, why I'm a member of the Techquity Coalition, because we have to lift up this idea. And so one, it was just a delight to learn of the work that you guys are doing. So to your point around proving value, can you give us a sense of the conversations you've had with like health plans as it relates to that? Like, are you capturing reimbursement for these other pieces? So unpack that for us.
Done with our AI advanced analytics, and we work with a company, Foresight Healthcare Solutions. And actually, we've been using AI for, almost 5 years now. So yeah, so for some, it's, that's the new buzzword. Well, I don't know, it's been our buzzword for quite a while. But again, you can't do it without the data. So just very quickly, we've been able to capture not only those HCC codes, our payers, for those not familiar, payers look at patient risk based off of really one form of data, and that's the HCC codes that Medicare then assigns a risk, right? So if you have diabetes, high blood pressure. Well, our comprehensive risk model is way more than that, right? So it's besides that, we have our S2H survey data. We have been able to, make friends with our payers, or at least have negotiation where they send their claims data to us every month. So having that is really, truly invaluable. And then, of course, our EHR data. And then we also have we use natural language processing. That's another, it's not a buzzword. It's been around for a while, but we use it to look at our community health worker notes. And for those in that field, it's going to be mostly narrative. It's not going to be discrete data. So if you're picking up those particular words that can really illustrate the comprehensive nature of the kind of patients you're seeing. And now imagine being able to use that analytics to give you really, truly a comprehensive illustration of the risk score of an individual. Now, that's your predictive analytics, right? What their cost is going to be in terms of accessing resources, hospitalizations, and then the overall cost. Now, imagine if you can have, with all of that data, calculate an impactability score. I think we made that up, by the way. I don't know if there is such a thing as impactability score.
Sounds good.
It says what it says, right? So you may identify these patients at high risk for cost and poor healthcare outcomes, but what kind of impact as an organization can we have based on, sometimes payers attribute you a patient that maybe doesn't even live in your area anymore. Or maybe a patient really just doesn't want to engage, and we have ways to measure that. So then you make sure you focus on those that you can have a greatest impact. That's predictive still. Now you get into prescriptive. Once you've identified those, wouldn't it be great if you knew as an individual patient, out of all these 10 things, these services that we provide, social services, enabling services, care services, if we could identify the top 3 things that would help improve your healthcare outcome the best and have a cost savings, that's like a cheat sheet for helping someone to achieve and realize their best health outcome. Well, we've been able to do that with all of our data, our analytics partner. So just to give you an idea, we piloted with 2 of our local peers, and because that gives you negotiating power, right? So my COO says it's the grand bargain. The grand bargain is that if we say we're able to do what I just explained, And whatever is in that risk pool, whatever is left over, we're going to have it pair. You get back what the savings is. And then the 50 we get goes back into our same programs, into being able to, it goes back into our community so that we're able to provide, because food programs like food, our food is medicine, our community health records, those are not typically reimbursed. That service by a peer. And so that's really the grand bargain. There's a lot you can do. It really gives you that negotiating power for sure.
I suspect that'll resonate with a lot of listeners, right? Because everyone's searching for that.
That's our value-based care, by the way, right? So you don't have to go with the model that's being served to you. I think that's probably the takeaway. You can, as a community health center, look, we've been able to, I'm going to say, create the roles that others now can go, oh, okay, we can, and there's no downside risk for us. I mean, we're doing it all, preventive care as well as addressing really truly what the needs are now.
Your data actually provides true information, right? And insight to act upon and tweak and obviously it gives you greater level of confidence. So I love that. Clearly, government and policy are important stakeholders in this game. So what have you been able to bring to them and perhaps maybe get from them as a result of this effort?
And surely, in the digital front, when it comes to telehealth and then also just digital inclusion as a super social determinants of health. Now, I did not make that up. I would like to remind folks that our FCC back in 2015, they did their own study, and I would love for folks to read up on it, because if our federal government can identify that, they've done all the studies. I don't think we need to do any more. I think we just need to know that really truly exists and we need to start addressing it. But in terms of policy, each state's Medicaid system works differently. And so with the study that we've done in terms of the impact that, or really maybe a paradigm shift to really truly looking at a hybrid virtual care model, right, in primary care. So I think behavioral health, there's a lot of great information on that. And we see that there's really truly benefit for both telephonic and televideo. In primary care, not so much. But we've done a study and that's actually what I recently presented at the ATA, as well as a NAC conference just a few weeks ago. And what we're hoping for that is that'll impact at least our state Medicaid director in seeing really the value of telephonic care in primary care, because it helped so many, quite honestly, during COVID. And the fact that now it's been rolled back in terms of we still provide it because it's a community health center. We want to break down any barrier to healthcare. But in terms of reimbursement, it makes it really difficult, not only for us as a big CHC, but for smaller CHCs in terms of financial feasibility to offer that as a service, but you're not being reimbursed. The other thing that I found, at least in our community, when it comes to the accessibility with our community Wi-Fi infrastructure, we have been able to influence actually a recent bill that just went through that's creating the framework for all of the grant money that's coming in from the Internet for All, millions of dollars into each of the states, right? It's billions of dollars that have been set aside for getting our communities connected, especially rural. But we've been able to influence it in a way that we can hopefully better fund the accessibility part, right? So the community Wi-Fi infrastructure part. Because without that, there's digital literacy, but if you're not connected, then you can't use any of those things. And so it starts with access for sure.
I'm just so grateful for you joining us today. Tell us where the project is now, what your sort of vision is for the next 10 years maybe, and then any parting words for our audience.
Sure thing. Well, first of all, as you get older, when I was younger, 10 years seems so far away. As you get older, 10 years is like, I don't have enough time to do everything I want to do. But I'm actually really excited. I've partnered with University of Mississippi Medical Center. So again, getting back to really, you can't do any of this alone. There's collaboration and strategic partnerships. But UMMC is one of two in the nation who are HRSA designated centers entities for telehealth. And so we have gotten together to do a data scarcity project. And so what that's going to entail, we're working with T-Mobile. We have 150 iPhone devices with unlimited cell plans that we're going to deploy out to patient participants who have uncontrolled or poorly controlled diabetes. We want to see if connection without limitations to their provider will help to improve their diabetes, so their hemoglobin A1C, that's going to be our indicator. And that's going to be through not only the access to healthcare when they need it, but also a health literacy part. So we as a community health center have created a mobile app, and it's a community health network app where you have all your social services connection to your provider in one mobile app connection. And so that's going to be deployed onto the phones. And so really we're looking to see whether or not what kind of impact on hemoglobin A1C. And then we also have a national health literacy survey that will do a baseline. And then after the project, it'll be a 12-month project, really directly having the patients use whatever resources they need. And then we'll also continue that on hopefully for another 12 months after that to see really a longer time frame and impact. The great thing about that is I was able to work with our T-Mobile partners. And so during the summer, before we deploy those phones out to the patient participants, I'm going to have computers for our community specifically on iPhones. Yeah. And so because a lot of the work that we all know, a lot of the work we do are on cell phones, including applying for jobs, including you can upload resumes now if you know how to use Microsoft 360. So I want to be able, the whole part of digital inclusion is access, digital literacy, and then the last part that we all need to remember is the adoption and usability. And for me, usability means making sure my community not only knows how to use it, but they have the opportunity, like everyone else that takes technology for granted, right? Access to the same opportunities. Beyond healthcare, there's education, there's workforce development. And e-commerce. I mean, we have lots of entrepreneurial spirits out here in Waianae, and I want to make sure that they have the same opportunities. So that's what, and working with Livy, I'll leave you with this. Working at our last community summit, our own community came up with a LEADS initiative. So literacy, education, development, sustainability, accessibility. I forgot the A in there. So, and that's from our community. They came up with a Waianae LEADS. So there's lots of not only what each of those letters stand for, but really we want to be the leaders, not being the best at having the highest diabetes prevalence, not being the best at having the highest obesity prevalence. We want to be the best at being innovative and having the same, or if not better opportunities. We want to be the innovation hub where folks come to us, right, and want to learn from us, and we can uplift our community. So I'm going to leave it at that because there's lots of work to be done. But I know that if we all work together, that's what I found. We're making good things happen.
I love that. Thank you, Chrissy.
Mm-hmm.
Well, thank you so much for joining me today. Congratulations again on your award. And for anyone interested in learning more about the work of the Techquity for Health Coalition, please email info@healthfoundation.org. That's info@HLTHfoundation.org. Thank you for joining us.
Well, mahalo, Michael. Mahalo, everyone. Yay. Appreciate it.
Thanks for joining us as we've explored this winning Techquity case study. To learn more about the amazing work being recognized by the Techquity for Health Coalition and see all the incredible winners we've featured throughout this series, head over to the dedicated Techquity landing page on the Hit Like a Girl website. You'll find it linked in the show notes. Before you go, remember to like, follow, and subscribe to the Hit Like a Girl podcast wherever you listen. And if you've enjoyed this episode, please share it with a friend who might be interested in digital health equity. All right, thanks. See you soon.